Nuclear technology and medicine. Nuclear technology and medicine. Despite the fairly bad reputation that the word nuclear has, such as atomic bombs and nuclear weaponry, there are a wide range of non-military uses of nuclear technology, from electricity-generated power plants to radioisotopes allowing smoke detectors to function. Nuclear technology offers many ways to generally improve our quality of life. One of the most important fields that utilizes nuclear technology in this day and age is medicine. In the medical field, nuclear technology offers some of the most critical methods of diagnosis and treatment in the field. For over 120 years, mankind has been utilizing nuclear technology to increase our quality of healthcare. Nuclear technology is technology that involves reactions caused by the atoms, molecules of unstable elements. Stable elements are often referred to as radioactive elements. The atoms of unstable elements contain an excess of energy, which causes them to undergo spontaneous changes. The changes that are most important in medicine are alpha decay, beta decay, and gamma decay. In alpha and beta decay, the atom/molecule of the unstable element/compound releases particles. In gamma decay, however, the element instead releases high-frequency electromagnetic waves known as gamma rays. In November 8th, 1895, a physicist named Wilhelm Röntgen discovered X-rays in an experiment involving cathode tubes. The first picture on the right is a picture of his wife's hand. This caught the attention of another physicist, Henri Becquerel, who was inspired by Röntgen's discovery. In 1896, the following year, Becquerel set out to test a theory of his that a radioactive compound generated X-rays after being left out in the sun. The experiment failed, but in its failure, Becquerel made a discovery. Even without an external energy source, the radioactive compound still generated energy. The shadowy outlines on the second picture are where the sources were left. The energy was later named radiation by physicist Marie Curie. Almost immediately, X-rays were being utilized. In the following year, 1896, they were used in the Abyssinian War to scan the bone fractures and embedded bullets within wounded soldiers. And on the battlefield especially, X-rays became very useful. In the 1930s, physicist and physician John Lawrence saw potential medical use in radioactive isotopes produced from his brother's invention, the cyclotron. He put these radioisotopes to the test in 1937 by treating a bone marrow disorder, and in 1939 by treating leukemia, both of which were successful, and this signaled the invention of nuclear medicine. Over 10,000 hospitals around the world utilize radioisotopes in medicine. Just in the United States, there were over 20 million nuclear medical procedures undertaken in a year. Most usages fall into three categories: diagnosis, therapy, and sterilization. While X-rays can be generated from radioactive source, most X-rays nowadays come from an electronic source. The GIF, is a PET scan utilizing a radioactive tracer, and the red spots are tumors. Nuclear diagnosis is usually undergone by injecting a low-energy radioactive tracer into the patient, utilizing gamma cameras to record the radiation coming from within. Examples of diagnosis methods include positron emission tomography, such as PET scan, computed X-ray tomography, a TT scan, and single photon emission computed tomography, SPECT scan. Nuclear therapy is primarily used in the treatment of cancer. The types of radiation mentioned earlier are referred to as ionizing radiation, and they can cause significant damage to living tissue and DNA, especially in rapidly dividing tissue, which makes it very useful in combating cancer and other malignant growths. External, which is focusing radioactive beams on the affected area, and internal, which is implanting actual samples of radioisotopes, are treatments usually used when treating tumors, malignant growths, and cancer. Brachytherapy is the short-range radiation therapy. Little white beads seen here are beads of a radioisotope which have been implanted to combat prostate cancer. Medical equipment in need of sterilization can be given a short blast of gamma radiation in order to kill any bacteria and viruses residing on it. Because gamma radiation can pierce multiple layers, items such as surgical gloves and anything sealed can be sterilized without breaking the seal, effectively giving it an infinite shelf life until it is opened. Gamma sterilization is also useful for sensitive items that cannot be treated with heat, such as powders, creams, and tissue grafts. Gamma sterilization is in fact cheaper, quicker, and all around more efficient than steam heat treatment. As time progresses, there are breakthroughs made in medical nuclear technology, such as targeted alpha treatment, which is a form of radiation therapy that only affects tumor tissue without much healthy tissue exposure. It's also useful in treating dispersed cancers. It's expected that different modalities will become obsolete, and instead nuclear diagnosis will focus on specific diseases and organs, offering greater efficiency and patient personalization. Better understandings of how nuclear materials and biology interacts also will be understood, allowing for better treatment and minimization risk. As well, technological upgrades can be expected.